One of the most common questions we get asked in the TMJ world is why people's jaw makes noises. So the first thing I want to do is kind of share what the jaw does as far as movement, where the noise comes from, what it means for you, and why sometimes even after we treat TMD, or TMJ as it's commonly called, the noise is still there. So I'm going to walk you through a video that is actually on YouTube. This is a video called TMJ Anatomy, and it's a really helpful way to understand this. So the first thing I want to show you is how a jaw moves. So what you'll notice in this video, the jaw joint, super unique joint in the body. It's one of the only ones in the body that will rotate and slide. So as we open a little bit, jaw opens a little bit, it rotates. Real wide one, it'll slide forward. So the actual movement of the joint is just like this picture here. That's a healthy joint. This joint is quiet. And you might notice this pink. So this pink is a disc. Think of it as a shock absorber. A jaw that's moving well, this is in the right place. A jaw that's displaced, or a disc that's displaced, is sitting typically forward like this. So what this means for a lot of patients is the shock absorber is dislocated. And now when you close your teeth, you're hitting nerves, blood vessels, tissues that aren't designed to take force. That's where a lot of chronic pain, headaches, neck pain is sourced from. When we run through this, what you'll notice, if you remember, the jaw opens and then slides, opens and then slides. Very commonly, you'll get something like this. Pain when you're closed. As the jaw starts opening, it pops back onto place. As it closes, it displaces backwards, just like that. There's the pop. There's the displacement. So as weird as it sounds, it's actually the jaw relocating to the right spot is the pop you hear. So as we open, the space is created, the shock absorber pops back into place. When we close, it dislocates back out. That's the noise. The biggest thing to understand, all jaw joint noises are pathological, meaning something's off if it's making noises. Doesn't necessarily mean we have anything that we need to treat, but it's always worth digging into if your jaw is making noise. Just think it's out of alignment. Your jaw joint is out of alignment if it's making noise. Another way to think of it that really kind of opens patients' eyes to this is the reality of a popping jaw is when your teeth are closed, your jaw is dislocated. When your teeth are open and that pop happens, that's your jaw relocating to the right place. So think about that in terms of shoulders. It would mean if your hands are like this, your shoulder's out of socket. When you lift your hands back up, you've popped your shoulder back into place. I would imagine most people, once they understand that their shoulder is out of place at rest, would go to the emergency room to get it back in place. So that's an important concept to understand in how a jaw joint moves. Quietness is good. Popping means something's off. We should probably look at it. Now, a very common thing when we're treating TMJ is you'll actually still have noise at the end of it. Here's the short answer. That's fine. We don't care. Because the human body is an amazing healing machine. So very often what will happen is it'll make what they call a pseudo disc. And it shows this in the video. After it goes through this, it's going to show you the popping and clicking. It's also going to show you, so the bigger concept before we get into this pseudo disc is what happens after the popping if nothing is done. It's not necessarily that every jaw joint that pops is going to get to this place, but this is the risk of doing nothing. So over time, that disc that we were talking about that springs back and forth, that disc will actually stop springing back. It'll lose its springiness. I think of it like a bungee cord, you know, the storage cords that you use to strap things down. Over time, they'll lose their springiness. And the same thing happens right here. So after a while, what can happen, and you tell me if this has happened to any of you guys, is when you go to open, you can't lower your jaw all the way. So you have the first motion, you don't have the slide. You have the first motion, no slide. That's a lock. So I think of that like a speed bump. Your jawbone cannot get over the hump of that disc, so you lose range of motion. Doesn't necessarily mean your jaw's locked like this and you can't close it. It just means you don't have full range of motion. This is what I would call kind of the threshold or a It's the downswing of the roller coaster. So when you get to locking, we already know there's been some permanent damage that we're going to have to reverse. So that's an important thing. What we want to do is not get to locking. Locking makes everything harder to do. So this is a big concept. We don't want the jaw to lock. We can still fix it. It just takes a little more effort. Why does the jaw still make noise after we go through TMJ treatment? Very typically, it's because over time your body is adapting. And what your body will do, just think callus. It will actually remake or try to remake a second disc so that it does not cause injuries. So now you'll hear this gravelly noise. You'll still have some popping, you'll still have some reduction. In our world, that's all fine because we're treating to two goals and two goals only. Absence of pain to improve your quality of life, full range of motion, right? You should feel good. And I don't mean pain in the jaw joint. I mean pain here. I mean pain here. I mean pain here. All the muscles that are compensating because we're avoiding our jaw pain are the muscles that'll actually start hurting. So we need to upright the head. We need to relocate the disc. We need to restore range of motion. That's putting the body back in alignment. That's the most successful way to treat a simple jaw joint. All of that can be discovered from a little pop. So I hope that helps. Please ask if you got any more questions. Please call the office if you need anything else. Otherwise, thanks for listening, and we appreciate the time.